least some of the physicians I've worked with, they can be incredible educators in the university, and they can also be great caretakers in the hospital setting. And that's really how I chose to pursue the degrees that I have.
Welcome to Learning from Experience, a podcast for college students and recent grads who want to hear directly from alumni on how they've adjusted their lives post-graduation, including personal stories of success, career readiness, and tips for navigating the real world. Created by the College of Liberal Arts and Sciences at Arizona State University. I'm your host, Megan Finnerty, and today I'm talking with Madison Billingsley, who graduated from ASU in 2020. She was a double major in the college with a degree in biochemistry from the School of Molecular Sciences and a degree in global health from the School of Human, Evolution, and Social Change. Madison then went on to get a master's in international health and worked at Johns Hopkins on a vaccine clinical trial, and is now attending medical school. Thanks for coming on.
Thank you for having me.
Okay, so 3 degrees, you're on your way to your 4th. Tell me about how you became interested in biochemistry and global health.
So I think a big thing that drew me was knowing that ultimately I want to go to med school. And a big part of that just comes from what I see as physicians is the capacity to merge scientific understanding of disease with the social understanding of it. Not everything that we think of when we think of the flu or when we think of STDs or when we think of diabetes has to do with the biology. There's a really big social component. And so I really wanted to go into a program and go into a career that understood both of those and that could treat diseases as things that happen to people and not just biological phenomena.
If a listener is unaware of global health or public health and what that means, how would you best describe it?
Yeah, I think for global health and honestly public health in general, it's really looking at that. The grad school I went to, their motto was saving lives millions at a time. And that's really what it is. So when we look at the things that we do, maybe we volunteer at a small community, or if you're a clinician, maybe you see a few people. Public health and global health is really saying, let's not focus in on a few people, but let's look at the entire population. Let's see what the entire population is dealing with and how we can help all of those people, and kind of looking at these big scale interventions.
When you were a student at ASU, did you have opportunities to engage with different communities?
Yeah, so one of my degrees, like you stated, is through SHESH, the School of Human Evolution, Social Change, and it was a global health degree. And for any students who don't know, part of that degree is you're required to do a study abroad. And that was a big selling point for me, because what better way to convince your parents than to tell them, I have to do this for my degree. And the program that I ended up doing was through HEAL International, and it was a program dedicated to HIV education. So we spent a lot of time learning how to talk about HIV, getting all the correct information, spent time talking to people in Arizona, and then spending about 5 weeks in Tanzania, also having conversations again about HIV and HIV information with members of the community, and kind of bridging that space between local and international health and education.
What's something that you took away from that experience?
Yeah, I think a big thing for me that came from the program was just reconnecting with my community, which maybe isn't what we think of when we think of studying abroad. But I really loved being able to have conversations with people, and I looked at all the people in my life who really mattered. And I thought, wow, I would love to continue doing this work. And whether it's in this continent or another one, what I'm passionate about is education and empowering people to feel confident in their knowledge, especially when it comes to health.
I was just thinking that in my head, when I think of doctors, I often imagine TV shows like Grey's Anatomy, The White Coats, and I only see them in surgeries in hospitals. But the way that you're talking about medicine too, you're sharing about work in the community and providing education. How do those two ideas of doctors connect?
So I think what you're talking about is what a lot of people experience, that like doctors, they might be intimidating, like maybe they're a big thing on TV as these all-powerful surgeons. You see them for 10 minutes, but really you're under anesthesia most of the time. Or maybe you're seeing them once a year for a physical. For me, I wanted it to be more than that. And so I chose to do a public health degree to kind of branch that big, large scale, like working with communities, with that small, seeing a patient one-on-one in the room, having that conversation. My metaphor, I guess, is that public health is your savings account and clinical medicine is your checking account. At the end of the day, if someone comes into the ER with a heart attack, you really can't tell them, don't worry, we're going to cure heart disease by the year 2050. You're going to offer them care. You're going to want them to have the best health outcomes. But public health is that person, that savings account, that looking at the future saying, okay, in 15 years, we want to have less people coming to the ER with chest pain. We want to have less infectious diseases. What can we do that maybe isn't going to happen immediately, but to make those big plans and to contribute to those bigger goals that we have?
That example of a savings and checking account is really great. So if you were to talk to students today who are trying to navigate their future plans, what advice would you give them?
One of the big things that I would say, and this is as someone who has a master's, is that grad school is not always the answer. And one of the big things that I draw from, and especially talking to friends, whether they are in business administration and they say, oh, well, I want to break into public health, so I need to go get an MPH. Or someone who says, like, well, I like science and I want to help people, so I have to be a doctor. I don't think those are universally true. And for me, the way I approach it is kind of my methods and my topics. So going to public health school, I could had my topic. I want to do public health. I want to do infectious disease. And being there, you get exposed to a lot of different ways to do that. So you can do it through research. You can do it through being a clinician. You can do it through policy. So maybe you're not seeing patients, but maybe you're writing the policies about how to address diabetes in a country. There's so many things that fall within one topic. There's so many ways to approach it. So someone coming from a business administration background, if business administration is their methods, there are public health organizations that need supply chain managers. We need to get HIV tests to people, and we need a supply chain manager to make sure that they get on the truck, that they get to their location, and all of that. So when looking at it, really figuring out, okay, what is my methods? Maybe I'm great at math and I want to do something with my math, and I just have to figure out what it is. Maybe I'm great at law and I want to do something with law and just figure out what it is. Or maybe you have a topic in mind. So maybe you love maternal child care and you want to say, how can I help with this? Maybe I don't want to be a doctor. Maybe how can I help with this as a researcher? Maybe I can do interviews because I'm really good at talking to people. I think if you can at least figure out your methods or your topic or both, it's going to help show you, okay, what is my best next steps? And sometimes that's grad school, but for a lot of people, it really doesn't have to be. And so when you really look at what matters to you, how do I want to help my community? How do I want to make the most of my strengths? That's kind of my approach to it.
Just to emphasize your last point, what was your method?
I think for me, my method is like health education and clinical care. And so that's really why, going back to what we talked about in the beginning, that's why I chose to be a physician, is because at least some of the physicians I've worked with, they can be incredible educators in the university, and they can also be great caretakers in the hospital setting. And that's really how I chose to pursue the degrees that I have.
So during your undergraduate, your study abroad was really influential. What has been an influential experience that you've had after ASU?
Yeah, so one experience that I had as a graduate student was getting to work for my professor at this vaccine clinical trial center. So as a graduate student, I took a class from her, and it was my favorite class. It was about tropical medicine and infectious diseases. And at some point she offered me a position, and I had really never considered working in the clinical trial space before, but she was so nice that I definitely wanted to pursue that. I said, yeah, of course, I would love to join your team. And through there, I got exposed to the world of clinical trials, which I thought was really great because it combined those interpersonal skills with that science. So, part of clinical trials is recruitment. So I was talking with people every day, whether they're people who worked for the university, whether it's people in the community, or other scientists and researchers on my team. So we were having a lot of social conversations, a lot of conversations about health, but then we're also still on the back end doing that scientific work, understanding what was happening with our study, how many adverse events or problems were associated with the product that we were studying. And it was really a great and unexpected way for me to learn that research was more than just boring, like sitting alone in a room in a lab, but it could be this great thing. You can make translational work and you can engage and do a lot more than just pipetting.
I know that you've just started med school in this new journey, but looking back over your life so far, what's something that you've learned from experience?
Yeah, one thing I would say, and I'm probably not the first to say it, is that getting in the room is probably like 3/4 of the battle. So both in undergrad and in grad school, just being able to be in someone's radar is so much more than what skills you necessarily bring. So in undergrad, it was just staying for office hours for one professor and having her listen to my interest in graduate school, that she said, okay, like, I'll be one of your letter writers. I will edit your personal statement with you. And that's the same in grad school. You think like, oh, I have to apply for every position. But really what ends up happening a lot of the times is you get in with a professor, they know your name, and something comes along and they say, hey, I know your face. I know what kind of work you do. Do you want to help on this project? And maybe you're not the best biostatistician. Maybe you're not the strongest epidemiologist, but really what comes down to it is they want to see you succeed. They know your face. You've interacted with them enough that instead of posting a job application, instead of going on a search for a new person for their team, they really want to see, hey, are you interested? Do you want to work together and learn this skill? And really that's, I think, what can help give people opportunities more than just applying for everything that's available, but making those strong connections with a few people that they are really passionate about, that they really love learning from, and then being able to be there the next time that person has a project.
Thank you so much for coming on, Madison, and leaving students with the advice to figure out your own method or your topic, and then also that encouragement to just be in the room, find a way in. If you'd like to connect with Madison, her email is mbillin4@asu.edu. To hear more alumni advice, head to our episode page wherever you listen to podcasts. Check out the college's YouTube channel or visit thecollege.asu.edu/LFE podcast. See you next time.